Inspect the eyelids and eyelashes for position, appearance, and blinking.
Inspect the eyebrow for hair distribution, alignment, skin quality, and movement. Inspect the lashes for evenness of distribution and direction of curl. Inspect the eyelid for ptosis and frequency of blinking.
Observe the position and alignment of the eyeball in the eye socket. Inspect the conjunctiva and sclera for clarity and appearance. Inspect cornea for appearance. Inspect the iris and pupil for shape, quality, and color. Inspect the lens for clarity and texture by using a pen light at an oblique angle to the eye. Inspect and palpate lacrimal apparatus for appearance and response to pressure applied to lower orbital rim. Check distance vision with Snellen's chart 20 feet from the client.
Ma'am, pwede mo lang tapunan ng isa mo kung pag-i, basta ko lang ako. E, F, C, E, O, Z, L, E, B, G, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, G, G, E, F, P, O, T, E, Z.
Check near vision with newspaper approximately 14 inches from the client's head.
Sentences.
Miss, pwede mo lang cover liwatan rin ng isa kang matara. Magpasahalan din na kay is assess a child by check the first of danger signs. Thank you.
Check peripheral vision. Position yourself 2 feet away from the client at eye level.
Cover ako na lang ay. Tapos tulog ka lang din sa ballpen. Isundan mo lang miss kung may ibang nakatawa. Okay?
Check for accommodation.
Yes, isundan ang miss ang ballpen ni Miss ha.
Check for extraocular movements.
Ma'am, isundan mo lang ang ako na ballpen.
Check corneal light reflex. Check direct and indirect consensual pupil response. Check for abnormal movement using cover-uncover patch tests.
Assessment of the ear. First, we need to inspect external ear for size and shape, position, lesions, and discolorations. Next is to palpate external ear. Palpate mastoid process for tenderness, temperature, and edema. Inspect auditory canal for cerumen, appearance, and tenderness. Inspect for tympanic membrane or eardrum for color, consistency, and landmarks. Assess gross hearing ability approximately 60 cm from the ear. Whisper a number or word.
4, 6, 8.
Assess for lateralization of sound using the Weber's test. And then assess for comparison of air conduction to bone conduction using the Rhine test.
It helps the speaker lead his audience into.
Perform Rumberg test. Just stand at the side of the patient, put our arms in front of the client and at the back of the client for support in case the patient falls.
Inspect open and close mouth for symmetry and alignment. Wearing gloves, inspect and palpate lips for color and consistency. Wearing gloves, inspect and palpate buccal mucosa for color and landmarks. Wearing gloves, retract lips to inspect and palpate gums for color and consistency. Inspect protrude tongue for symmetry and texture, movement and color. Tongue is pink and moist with papillae on the dorsal surface. Inspect ventral surface of the tongue and mouth floor for color and landmarks. Inspect hard and soft palate for color and consistency. Inspect oropharynx for color and landmarks. Ask the client to say ah and watch for the uvula and soft palate to move. Observe external nose for skin, appearance, shape, and nares. Check patency of the airflow through the nostril by occluding one nostril at a time and asking the client to sniff. Normally, the client should be able to breathe through each nostril. Inspect internal nose for appearance and landmarks. Turbinates and septum. Palpate sinuses, both frontal and maxillary, for tenderness. Palpate the frontal sinuses by using thumb to press up on the brow on each side of the nose. Palpate the maxillary sinuses by pressing thumb up on the maxillary sinuses. We observe our patient for sign of discomfort. Cast sinuses for resonance. This is to determine if there is pain in the sinuses.